Hi, my name is Dermot Kearney. I'm a cardiologist working in the northeast of England, Queen Elizabeth Hospital-Gateshead, affiliated to the University of Newcastle upon Tyne. I'm also the current president of the Catholic Medical Association in the United Kingdom. Today we're going to discuss the issue of conscience, particularly conscience protection for medical students and residents. First of all, I thought we'd at least clarify or define exactly what is conscience. Well, a simple and accurate definition is a person's or an individual's moral sense of what's right and what's wrong. And therefore, conscience protection relates to defending the rights of a person or an individual to act and increasingly, I'm afraid, think according to their sincerely held moral, conscientious beliefs. We could spend days talking about conscience and conscience protection, dealing with lots of different issues, but I thought we'd just concentrate on a couple of the key issues. So in relation to how do we approach ethically challenging topics with patients, and what do we say to patients and to our colleagues, particularly when we're put in a position where we're expected or requested to carry out some procedure or management strategy that we find morally objectionable. How do we approach that? And similarly, how do we manage to pursue our careers without coming under too much criticism or under fire for alleged discrimination against patients or groups of patients? Threats to conscience in healthcare can come from a variety of sources. They might come from the patients, perhaps even more so from our colleagues. They may come from our managers, our hospital administrators. They may come from regulatory bodies. They may come from the courts. If the courts decide that certain procedures are within the law, then it can make it difficult or ethically challenging for us in some situations. The first thing I would say in dealing with these issues is don't be afraid. We have to have courage, because there is nothing in Catholic moral teaching that is contrary to truth and science. Truth and science are on the side of Catholic moral teaching, and that's perhaps the most important principle to hold on to. We should be honest. We should let our colleagues and our patients know our stance and not be afraid to inform them of our conscientious position if challenges do arise. We need to be very well prepared. So particularly if you're working in areas or studying in areas where you're very likely to come across ethically challenging situations, so obstetrics, for example, or general family practice, you need to anticipate the difficult questions because they're going to arise at some stage. So you need to have gone through well in advance what are you going to say. And it may mean talking to other people about how they approach it as well. The issues, of course, are pretty obvious: abortion, contraception. In some jurisdictions, assisted suicide and/or euthanasia, including, however, the withdrawal of hydration and nutrition that is necessary basic care to keep people alive. Some of the maybe less obvious ones would be in relation to requests for assisted reproductive services and perhaps management of erectile dysfunction. One area that is likely to cause increasing dilemmas for Catholics and other persons of faith in healthcare provision in the years to come is the issue of patients with gender dysphoria problems who may be seeking some management strategies in those areas. So after the first piece of advice of being courageous and to be honest and to be well prepared, I would say we need to know the facts. So we need to know a little bit about, or a good deal about these issues. So even though we may not be prepared to provide hormonal contraception or abortion services ourselves, we need to know what these procedures involve, because we need to be able to explain our position to patients, to our colleagues, and we need to have an understanding of what these procedures involve. And particularly, we need to be able to inform people of our concerns over the potential harmful effects. For example, in abortion, but not only for the developing child in the womb, but also for the mother, both the psychological and long-term physical side effects, the adverse effects that might result. Similarly, with contraception, there's lots of information out there to help us to inform not only ourselves but others if the situation arises where we have to defend our position. We should know and understand what the official church teaching is, because many Catholics, even working in healthcare, do not know what the church's position is, for example, even in contraception or in assisted reproduction services. So we need to inform ourselves what exactly the church's position is, and to be able to explain it in a simple and clear way to our colleagues and to patients that may come in contact with us who may not understand the church's position. And that's a very common problem, is that the misconception, misunderstanding, even among quite well-educated groups. For example, last year, the CMA in the UK successfully defended one of our students who was faced disciplinary hearing in her medical school because she had stated to her tutor that she wouldn't be prepared to prescribe hormonal contraception. So with a simple letter explaining the Catholic Church's teaching on the issue, we were able to sort the matter in a successful manner for her. And hopefully such situations won't rise again, at least that in that particular medical school. We should know the law, because there are some situations where we need to know, are we protected by the law when it comes to, for example, opting out of providing certain services. So we need to be well versed in what the law states in individual jurisdictions. We need to be consistent, so we shouldn't be prepared to, let's say, prescribe contraception maybe to married couples but not to unmarried couples, or provide Viagra, sildenafil to a married man but not to an unmarried man or to a homosexual man. So we must be consistent. So if we're not prepared to give certain types of medication or procedures to one group, we're not allowed in general, at least certainly in the UK, to make a moral judgment judging individuals. Either we find some procedure objectionable and therefore we don't become involved at all, or we should be prepared to participate. So we must be consistent and not discriminate against individuals. Very often when you hold a conscientious position, at first the person that you're addressing will be on the defensive. They will find that, or they will interpret that you are judging them, making a judgment that they're an evil person. And we must be prepared to take the time to explain that no, we are very respectful, we're sensitive, we do not discriminate against individuals, but there are certain procedures which we find objectionable in all situations, or certain management strategies. So we must be consistent, not discriminate against individuals, and we must make sure that they're aware of that we're not discriminating against them as individuals. As part of that, we must always be kind, we must be sensitive, we must be loving. We must show that we genuinely care about people in attempting to explain our position to them. It also gives an opportunity, if we're prepared and if given the opportunity, it gives us a chance to explain that there may be very valid alternative methods of dealing with certain situations that the patient themselves or our colleagues may not have considered. For example, a young woman in a crisis pregnancy may see that there's no other way out except abortion. She may not have considered the possibility of adoption, an open adoption, closed adoption, or seeking help from the many excellent pro-life organizations, crisis pregnancy organizations that will help her to get through, to overcome the difficulties with practical support, financial support, emotional support in many cases. We should be prepared to inform patients of their rights. So if we're not prepared to participate in a certain procedure, we should let them know that, or apologize to some extent, that we're sorry that we can't do that because of our beliefs, and we believe that this will be harmful to them. But if they really insist, that they do have the right to see another doctor in relation to that. So I would hope that keeping some of those principles in mind, it might be helpful. Finally, I think we need to earn respect. We need to strive for excellence in our studies and in our work, because if we are seen to be excellent doctors, excellent, caring, kind doctors, it will go a long way to convincing others that maybe the Catholic teaching on these issues, people who hold conscientious positions, are not so bad after all, if we still manage to provide an excellent service in all other areas. And we need to accept support. Sometimes we can't go through these procedures on our own. That's why organizations such as the Catholic Medical Association, the Association of Pro-Life Obstetricians, Gynecologists, mentorship, wise people who are sympathetic to our plight, to our cause, to our beliefs, can give us very good advice. So I hope that some of the information in this presentation will prove helpful. Thank you for your attention, and I wish you all the best in your careers, and God bless. Thank you.